Today on Riverside Strong, we'll explore the Riverside Cancer Care Network, a comprehensive network of cancer specialists offering advanced therapies and leading-edge treatments close to the comforts of home. This multidisciplinary team of experts works together to prevent, diagnose, and treat cancer across our region. The Riverside Cancer Care Network is committed to our community to provide education to understand risk factors and the importance of preventative cancer screenings. If cancer is detected, our specialists collaborate seamlessly to develop a highly personalized treatment plan. The Riverside Cancer Care team helps each patient make fully informed decisions about their care and supports patients and their loved ones in every step of their journey. This and so much more on this episode of Riverside Strong.
Adversity, disasters, emergencies, crisis. These are not the things that create character. No, these are the times, the moments that reveal character. You know what it also reveals? Compassion, empathy, humor, creativity, innovation, kindness, perseverance, knowledge, and strength. Perhaps strength most of all. We're Riverside Strong.
Welcome to Riverside Strong, where we examine a wide array of medical issues and learn from the medical professionals who treat them. I'm your host, Cheryl Nelson. Today, we'll learn about how the Riverside Cancer Care Network brings together an exceptional multidisciplinary team to provide the best possible cancer care to people across our community. We'll take a look at prevention, diagnosis, and treatment through the eyes of both patients and our care team.
When somebody hears they have cancer, it's probably one of the most frightening days of their lives. Often everything in their mind blanks at that point. They don't really hear or feel everything. They get very numb and their whole life rolls before them. Cancer is a disease. It's not life-ending in most cases, and that there is hope and there is always treatment available. Riverside Cancer Care Network is committed to personalized patient care that is data-driven, based on national guidelines, based on the best available information, but also with a personal touch that allows the patients to feel that they are personally being taken care of, that their families are being taken care of. And we do that from the moment they step in the door to the moment they finish their treatment. They're part of our family, and we welcome them. Between Shore Memorial Hospital, Walter Reed Hospital, Doctors Hospital, and Riverside Regional Medical Center, we provide comprehensive, seamless coverage. Patients and their families don't have to travel long distances to get world-class care. They get care here from practitioners who've trained at the best institutions in the country. They come here because they want to practice here in this area and help the patients in our community.
Riverside Cancer Care Network, as part of the Riverside healthcare system, is a not-for-profit organization. So it really means that our organization exists for the benefit of our community. We are very much about improving cancer care and reducing the burden of cancer for all the citizens in our regions that we serve. Some of the ways that we do that are by education, prevention, and certainly treatment. Physicians, clinicians, and other team members that have really earned the trust of people in the community to go out to churches, schools, and even centers that are big enough to hold a lot of people to come in and educate them, but also to provide screenings where they are. Riverside's mission is to care for others as we would care for those we love. And so when we talk about healthcare disparities and helping others in the community, it's really important to us to be there for those folks. And so we do that many times through partnerships that are very valuable to us and to people in the community. It's so rewarding to work with people like Charlie Hill, and we have a CDC grant, Every Woman's Life, where we are helping people, and we work with Mrs. Golden Bethune at the free clinic and providing Pap tests. We provide mammograms. So we're always trying to get education out. We are doing work as well across our system so that when patients go into their primary care physician or they go into diagnostics, the physician can talk with the patient about their family history and any screenings that they may need to get if they're behind in that screening. We really do care about people. We will take care of you if you ever have cancer. If you ever have any concerns, we will absolutely be there for you. And our team is standing ready to help you through this journey.
We are Riverside Strong.
The earlier cancer can be detected, the easier it is to treat. That's one reason why it's so important to have a primary care provider and see them regularly. Your PCP will recommend preventative cancer screenings depending on your age, personal and family medical history, as well as counsel you on risk factors like smoking. We'll take a look at how a simple lung cancer screening test is providing peace of mind for individuals who have no symptoms but are at higher risk of developing lung cancer because of their smoking history and age.
When Dr. Mosen became my primary care physician, I was a long-term smoker back then, and she recommended I have the CT screening. So basically every year now I've had a CT lung screening.
When a patient comes for a visit with a primary care physician, they not only come for management of chronic medical conditions like hypertension, diabetes, they also come in to address screening and vaccinations, and they want to be as healthy as possible when they go forward. And when they leave the doctor's office, they want to feel like everything about their health has been addressed. And part of that is screening for any cancer that they would be susceptible to. Low-dose CT scan for lung cancer screening in certain individuals causes us to treat it early, catch it early, and actually decrease mortality rate by 20%.
Getting a low-dose CT, it's basically about 15 minutes out of your day. You check in with the radiologist, etc. Basically lay down on the table, they run you into the machine, tell you to hold your breath for all of about 10 seconds, and you're done. It's painless and simple, easy, and doesn't take any time whatsoever.
A lot of patients are apprehensive about getting a screening for cancer. Just because you're getting screened for any types of cancer doesn't mean that you are going to have cancer. This is for prevention of cancer or early detection of cancer, so we can have a better outcome of whatever you're dealing with. If we catch it early, we can treat it early, and you will have a better, longer quality of life and quantity of life. My father passed away from lung cancer in 2000. He was a long-time smoker. He fit this criteria completely. I can't help but think that if this guideline was there in 2000, we could have caught it early. By the time we caught it, he was stage 4, and there was only 4 months in between diagnosis and him passing away. Lung cancer is still the leading cause of death in the United States. Obviously, the prevention of lung cancer is more important than screening, and prevention includes smoking cessation counseling and helping them with smoking cessation.
Take a look at it. I was a long-term smoker. I was running at one time a pack a day. At the time I saw Dr. Mosen, I was probably about half a pack a day. And I had been smoking since I started my time in the military. It's from 1975 to 3 years ago. So yes, it was one of those. It was a risk factor, big risk factor, and this was one way to eliminate that factor.
Health maintenance is important during at least once a year. Even if you don't have a chronic medical condition, you should see your primary care physician so that age-appropriate health maintenance can be addressed. That includes screening for various types of cancer if you're in a high-risk group, vaccinations, and other screenings. The most rewarding part is that when I talk to the patient and through shared decision making, we decide that we're going to screen for it. We find something, we treat it early, and the patient comes back in my office and tells me how good the experience was and how grateful they are for me to find it and treat it.
We are Riverside Strong.
Choosing a healthcare partner is an important decision. At Riverside, we understand that. We also understand what you want and need. Exceptional care, comprehensive services, access to a network of expertly trained medical providers, specialists, and care teams when and where you need it. And most importantly, a team dedicated to partnering with you throughout your journey of lifelong health and wellness. We say partner because at Riverside, we are healthier together.
Finding cancer is only the first step. A complete and accurate diagnosis is vital in creating a treatment plan that targets each patient's unique cancer. Bringing together the widest possible range of knowledge and expertise from many disciplines to evaluate and assess imaging studies, pathology, genetic tests, or reviewing results from other advanced diagnostic procedures allows the cancer care team to determine the most personalized and effective treatment or therapy.
My name is Linda Easley Fulton. I am a Riverside home care nurse. Towards the end of December, I noticed a small lump, and I wasn't quite sure if that was what was going on or if it was something hormonal. And Dr. Dwyer was like, well, let's get this checked out. She got me scheduled for a diagnostic mammogram and ultrasound. It was very similar to my regular annual mammogram, but it focused on the site where I felt something versus the entire breast.
The diagnostic study is typically more focused on maybe the one breast that we have that area or that one area within that one breast that we're trying to evaluate and sort out what's going on. There are several different abnormal findings that we could find on a mammogram. So depending on what we're seeing and the overall pattern that we're concerned about, the diagnostic could go in different directions. Especially if there's a concern for a potential mass, then ultrasound is also needed as a second check to look at things in a different way.
I became involved in Mrs. Easley's care after her biopsy. So she had a prior mammogram, which was normal, but then in the interval before her next mammogram felt something abnormal and very appropriately went to her physician for evaluation. Additional imaging was obtained which found a new abnormality which had not been seen on her prior imaging, which prompted a biopsy and led to the diagnosis of cancer. Because of the kind of cancer that she had, the radiologist realized that the standard imaging was probably not going to be adequate for evaluating the extent of her disease. And so they went ahead and recommended an MRI of her breast, which was obtained prior to my seeing her, which was very helpful because then I had a full set of information in order to proceed in my counseling of her.
Cancer is a complex disease, and it takes the expertise of many physicians, many practitioners, many support staff to provide the best care.
Kind of scroll through that so you can kind of get a glimpse of that demarcation.
We have tumor board meetings. Cases are presented to a group of physicians, experts in the field, and we talk about it in a collegial way and help our colleagues throughout the system in coming up with the best plan.
We have a routine meeting basically every week, and then I as a radiologist would present the imaging findings. The other team members, they'll discuss their perspective. The pathologist will review what they've seen, what they know.
We're trying to find out what the stage, that is how advanced the patient's cancer is. Is it just limited to where it started, or has it now spread or metastasized to the lymph nodes, through the blood system to another organ? Sometimes key questions can help the whole team go in a little bit different direction. And I think that collaboration is very valuable to all of us who provide oncology care.
We have a very close-knit cancer care team. All of the multidisciplinary physicians who are involved speak with one another on a regular basis. It's so helpful to have that because I know that at any moment I can call up one of my colleagues and ask them about what's going on with a patient or ask their input on an imaging study or a course of care. And having that close contact really helps us to advance the patient's care and make sure that we're all working as a team.
I think it was very important that there was a collaboration, so this way I wasn't running around and trying to piece it all together myself.
Mrs. Easley opted for a bilateral mastectomy, and we also recommended a sentinel lymph node biopsy to evaluate for involvement of the lymph nodes with the cancer.
Sometimes the surgeon will ask us to evaluate part of the specimen while the patient is still in the operating room under anesthesia, and we can perform a very rapid type of test called a frozen section. And the goal of the frozen section is to be able to render a diagnosis in a very short period of time, and I'll call that result back directly to the surgeon in the operating room to help guide the surgeon's hand, because we certainly don't want to remove more tissue than we need to or less tissue than we need to. You know, we're trying to make a complete surgery that works for the patient's best care.
We use a procedure called sentinel node biopsy, which uses mapping of the lymphatics which drain the breast into the axillary lymph nodes so that we can remove just those lymph nodes which are involved in draining the part of the breast that has the cancer. We take those specific nodes out, which can then be analyzed to evaluate if they have cancer in them. The procedure of sentinel node biopsy helps us to limit the amount of axillary surgery which is required, which limits the morbidity or complications to the patients afterwards. In the past, we used to have to take out all of lymph nodes to ensure that there was cancer in them, but this mapping procedure helps to limit that kind of complication that we saw with those patients.
In this modern era of cancer diagnostics, we're also performing molecular and genetic testing on patients' tumors. The goal of that is to try and get to what's been termed personalized medicine. And the idea there is if a patient has a certain molecular target or a mutation in their tumor, that target can be utilized by our medical oncologist to give the patient a certain type of chemotherapy or immunotherapy or some advanced therapy. It's important for me to always keep the patient first and foremost in mind every time I'm looking at their slides through my microscope here, or collaborating with others in the laboratory or in other medical specialties to try and always think about how can I help the patient further their care with best and most accurate diagnosis I can render.
Having the Riverside Cancer Care Network reassured me that there wasn't just one person looking at my case, looking at the diagnostic test results and making a decision. I'm very grateful that every decision was a collaboration versus one singular person making the decision. That my case was presented to the team to figure out the best treatment for me.
We're Riverside Strong.
Everyone's cancer journey is unique. The Riverside Cancer Care team values treating the whole patient, understanding that cancer affects all aspects of a person's life and the lives of those they love. They are here to provide caring support when and where it's needed.
The Riverside Cancer Care Network exists to help treat those patients in our community, in our region, in our area, and help them navigate that complex journey. We have practitioners, physicians, nurses, nurse navigators, and others who have trained at the best institutions in the world. We take pride in really individualizing the treatment and making a holistic care, treating the person rather than treating the cancer. And in order to understand how best to treat a person, you need to know what their circumstances are, what their family is like, what are the stressors that cause them to really become worried, and help to alleviate that.
My role as an oncology nurse navigator really is a lot of different things, and it's different for each patient. We try to put our patients at ease, make sure they understand everything that's being reviewed with them, with the medical oncologist or the surgical team or the radiation oncologist, because sometimes they get home and they forget to ask certain questions, or they didn't quite understand what the doctor meant by this is your type of treatment. And we are there as a reinforcement, and we re-educate and make sure folks understand their options, they understand their recommended treatment plans and what that means for them. We try to introduce ourselves to the new patient early on at the time of diagnosis, and then we continue to follow that same patient and their family through their journey, whether it's through the staging process, pre-treatment, actual treatment, whatever that may be, surgery, chemotherapy, radiation therapy.
How are you doing? I'm fine. Good. You look good.
Understand the importance of follow-up and routine scans in return for their scheduled appointments and not fall through the cracks.
And we're going to go right over here to the fourth chair.
We encourage family involvement, and we encourage family to ask questions because they might have different questions and different concerns. It might not just be the patient that needs emotional support, it might be the entire family, because they're an important part of their patient's life, and they're there every single day, and they're seeing the patient and what they're going through. So, the family might need resources as well.
My name is George Breckenridge. About 2 years ago, I was diagnosed with throat cancer. It spread just a little bit.
Mr. Breckenridge started with us probably about 2 years ago with head and neck cancer. Lots of team members have been involved with him, and he's utilized many of our services and many of the services within the health system. It started out in the beginning, of course, when he was first diagnosed with the head and neck cancer, and so he had lots of specialists to see, lots of coordination of appointments, making sure that none of the appointments clash, making sure he had transportation to the appointments, making sure he understood the importance of these surgical consultations and the scans, etc. And also help him with his anxiety. This was all new to him. He had not had a lot of experience with the medical community. Everybody was trying to work together to get him to understand the importance and the urgency of getting things done. Great thing about Mr. Breckenridge is he knows how to reach out when he needs to. And if he doesn't know who to reach out to, of course I'm always there for him to redirect and answer questions, things like that.
The home-based palliative team was very lucky because they got to know Mr. Breckenridge early on in his cancer journey. Palliative care is a medical specialty that specializes in improving quality of life for anybody that has a serious illness through things like symptom management. So if they have nausea, pain, things like that, we try and address those. Sometimes it's the patient and the family that need help, talking about what's going on in the home, but really looking at them as a whole person, so that during their treatment for whatever disease process they have, they're going to have the best quality of life possible. Palliative care can focus on the patient's symptoms, such as pain, nausea, anything that's affecting their quality of life, and allow that oncologist to really work hard on the cancer treatment. The home-based palliative care helps patients stay at home and minimize their visits to the emergency room or hospital by being able to identify different things that might be going on with them. There's always a nurse on call to provide support in their home while they're going through their treatments. When a patient's symptoms are controlled and palliative care, the social worker, the navigators, the infusion nurses, and everybody works together, the patient's feeling well enough that they feel that they can go through all of their treatment and get what treatment they deserve to have the best outcome from their cancer diagnosis. A positive attitude like Mr. Breckenridge's really helps an outcome for our patients. They light up when they see their staff. The staff lights up when they see him. Somehow, a terrible treatment becomes not as bad as it could be. Even though it's a hard time for these patients, they somehow rise to the occasion and have the best attitudes. Mr. Breckenridge is really an amazing man. He has utilized palliative care in the way that it should be used. I think the most rewarding part of being a palliative care nurse is knowing that we're honoring patients' wishes and that we can do the things they want, that this is their journey. We walk the journey with them. We don't guide their journey. And it's so wonderful to know that they understand their choices and pick what's going to be best for their lives.
There you go. Now you're on a beach.
Yeah.
The waves.
We provide many services for the whole person, and those include integrative therapies that are free to all patients. We also provide music therapy, pet therapy, massage therapy. We provide social workers. So we offer many services to patients because we really do care about the whole person.
The pillars of good care at the Riverside Cancer Care Network, the things that we really find are essential is one, personalized care, treating patients individually rather than as a number. Second is quality. Quality is key to getting good cancer care. We must and always look at how best to treat our patients and constantly audit and look over how we're doing and how we can do better. And then making sure that the patients feel comfortable here, that they feel that their needs are being met, both medically and otherwise, and so that we can really help them on the journey to recovery. I want everybody to understand that the Riverside Cancer Care Network exists for them. Our job is to treat them, to make them feel comfortable, to feel like they're being treated like a member of the family, that they're getting the highest quality, top-notch care that they can get anywhere in the world, close to home, a phone call away. And we're here for them. We're here for their families. We're here to help support them. We're here to help treat them. And we're here to help them navigate the complex journey that cancer always causes.
For more information about cancer prevention, detection, and treatment, visit us at riversideonline.com/cancercare. That completes this episode of Riverside Strong. For more information on Riverside Health System services and providers, please visit riversideonline.com. Missed our past episodes? Catch them all on YurView.com. Until next time, stay healthy and stay informed with Riverside Strong.
We're Riverside Strong.